Hey there, my name is Cynthia Veronica and I have two children, Samantha who is 3 years old and Sebastian who is 5 years old, and Sebastian just happens to have achondroplasia, which is the most common form of dwarfism. And in this video I want to talk about 4 reasons why I regret having my son Sebastian go through the tonsils and adenoids removal surgery. So let's get into it. The first reason that I regret it is because one thing I didn't know is that adenoids actually grow back. Tonsils do not grow back, adenoids do. And the younger the child is, the higher the percentage that your adenoids will actually grow back. So Sebastian was about 3 years old when he went through his tonsils and adenoids removal, and he being 3 years old, has now a higher chance of the adenoids actually growing back, and they can actually grow back with a vengeance. Meaning before he had obstructive sleep apnea that was pretty mild, in the future it can actually become moderate or even severe. And this is something that could have been avoided if I had actually known. So just to kind of backtrack, I talked to Sebastian's ENT about, removing tonsils and adenoids. The ENT actually suggested it when the sleep study results came back and we found out that he had mild sleep apnea. And just really quick, and this is a pretty basic explanation, but with sleep apnea, your results come back that it could be from 0 to 4. 0 to 4 is mild. Anything between 4 and I think 9 or 10 is moderate. 10 and above is severe. So he had about a 4, so he was high mild. Now he actually has very close to severe sleep apnea. It could potentially be from his adenoids growing back. So I did actually talk to various doctors before making the decision to have him go through the surgery. I talked to several ENTs. I did talk to his even audiologist. I talked to, the pediatrician and even a chiropractor. And the chiropractor was the only one that really said to me, look, ENTs are going to suggest removal because that's what they do. They do surgery for a living and that's what they know. But, if it's mild and if it were my child, I would be thinking about other ways to remedy this. Can he sleep with a mask and get oxygen that way and help remedy it that way? Or talk to your ENT about other options. So I decided to talk to a different ENT and I point blank asked, is there a reason why I shouldn't do this surgery? And she just looked at me and said, no, there is no reason why you should not get this surgery for your son. And by the way, this was an ENT that specialized in little people and dwarfism. So I did try to make an informed decision there. But even still, no one was telling me adenoids grow back, and the younger they are, they grow back with a vengeance. So I just wanted to put that out there. If you have a young child and they have mild sleep apnea and it's being recommended that they remove tonsils and adenoids, just know that the adenoids could grow back, and talk to your doctor a little bit more. Talk to them about concerns you may have, and let them know, if adenoids grow back, what are the chances? Ask that question, see what their response is, and hopefully this will help you make an informed decision. The second reason I regret having my son go through tonsils and adenoids removal is because the pain was unbearable for him. It was awful. There are some parents that'll tell you, my child got the surgery and just bounced back the minute they woke up from the anesthesia, and there's other parents that'll say, it was awful. I'm one of those parents. My son went through hell. It was very painful. It was so awful. It lasted weeks, not just 1 week, not just 2 weeks. It was a good month until he was fully recovered. He was only 3 years old. He didn't know what he was, why it was happening to him. He didn't understand the pain. He didn't understand that it would eventually go away. The doctors were telling me, oh, he'll be fine. Just give him ice cream. He couldn't even tolerate ice cream. you know, it wasn't one of those situations where, you know, you can tell your child, yay, you're gonna have ice cream for a week or two and you're gonna be able to eat it whenever you want. No, my child was too young to even understand that, you know, that was something for him to be excited about. Yeah, so the doctors were telling me he's really young, he will forget the pain. Maybe so, but it was an awful month to go through. It was torturous. We didn't sleep. He was up all night. He couldn't even tolerate Tylenol. Every time we gave him Tylenol, he would just throw it up and cry and cry and cry. The other thing was we had to just do suppositories and, you know, and try to give him pain medication that way. So it was just really hard. The other thing is that when we were in the hospital, the nurse discharged us right away, even though the ENT that did the surgery put in the paperwork that he should stay overnight in the hospital. She basically took out his IV and said, he's fine, we'll have him go home. And really, as a parent, I shouldn't have let that happen. I was really surprised. I thought, okay, I guess we're getting discharged, but I thought we were gonna stay overnight. But I didn't question her too much. But you know, given that he was in so much pain once I brought him home, we really should have stayed overnight for just observation as a precaution, because it was really scary once we were home and once he was just constantly crying in pain and throwing up, and you know, it was really rough. But also, you know, if something had happened, you know, we were far away enough from the hospital where it would have been a concern. So another tip I have is just, you know, ask your doctor for an overnight observation, just to stay in the hospital overnight for observation purposes, just for peace of mind. The third reason I regret, you know, going through the surgery for my son is that it was very difficult for him to swallow after the surgery, and it just became a choking hazard just in general, because before the surgery he was constantly drinking water all the time. He loved drinking water. After the surgery, he wouldn't tolerate water. He didn't want to drink water. The first time we gave him a sip of water right after he woke up from the surgery, you know, he had asked for water, and he took a sip and he felt so much pain that he had a diversion to water after that. And so it was really hard to get him to drink water for months, not just for, you know, the recovery time, but for months and months and months afterwards, to the point where we went back to the ENT. You know, we were asked, how's it going? And I said, look, he's not tolerating water, and this is something very unusual that happened after the surgery. And I just got like a blank look and got told, this never has happened before. This is something that's brand new. So there was nothing that was done about it. It was really hard just dealing with it. I went to a pediatrician who basically said, well, you know, let me connect you with a, you know, OT that specializes in I guess swallowing, or even speech therapists. There's certain speech therapists that also specialize in swallowing, and I think it's kind of more geared towards children with autism. But you know, that's something that was offered to us, and unfortunately I couldn't really make it work with my work schedule. It was just yet another therapy that we would have to go to, and it was just too much with me for work. Eventually he was fine and he was able to tolerate water, but it took a long time, and I was actually scared that he was never gonna drink water again. You know, the way he had before. And also, you know, just eating foods in general was really hard, and it really also took months to build up into that normal feeding routine that we had before. We had to stick to just soups and broths and soft foods for the longest time. And the fourth reason I regret the surgery is because, you know, with achondroplasia, there are certain risks when it comes to intubation for the anesthesia. So you really have to go to an anesthesiologist that knows what they're doing or understands the anatomy of a person with achondroplasia. So luckily we were connected with an ENT who specialized in achondroplasia, so they really knew the anatomy. And the anesthesiologist, I talked to him before the surgery and I asked him, have you done this before for children with achondroplasia? And he said many, many times. I've done this many times with other children with achondroplasia. So it was a relief for me. I was really happy to know that I had, two doctors, an anesthesiologist and the ENT, that both specialize in achondroplasia. But I know that not everyone has that option. And not only that, but I didn't find out who the anesthesiologist was until the day of the surgery. You don't know these things ahead of time, and they don't really tell you. They just tell you, you get whoever's available. So it was fortunate for me and for my son that we had people that were experienced. But going into it, it is kind of scary to think, to wonder, are they gonna know what they're doing to my child? I don't want anyone practicing on my child, but sometimes you just don't have a choice on who the doctor is gonna be. So that's just another reason to, try to avoid surgery if you don't really need it, if your child doesn't really need it, or if it's just not necessary. So I think it was just something that made me nervous going into it. So those are my 4 reasons. I wish I had made a more informed decision, just looking back, knowing what I know now, and hopefully this will help you make an informed decision if you are in the position of having to make this type of decision for your child, whether or not to do a tonsillectomy and adenoid removal in the future. So thank you so much for watching, and I will see you in the next video. Bye for now.